SoundLIFE is a one-stop hearing healthcare center that focuses on diagnostic and management of hearing disorder. We offer a complete range of hearing products and solutions for both our adult and children. We strive to provide professional and personalized hearing services by our trained audiologists. Our goal is to promote hearing healthcare as a part of healthy lifestyle, and our services include comprehensive hearing tests, hearing loss, tinnitus rehabilitation, and hearing aids related services such as prescription, fitting, tuning, servicing, and etc.
My name is Alleya Cheng. I'm founder and chief audiologist of SoundLIFE Hearing. I'm a believer of better hearing, better life. Living in the world of sound can definitely transform a person's lifestyle and personality.
In SoundLIFE, we are all certified audiologists, where we follow the best audiological practice in order to help our clients to rehabilitate their hearing-related difficulties. SoundLIFE Hearing was founded in 2016. All the operation, management, and clinical tasks are run by a team of passionate and qualified audiologists. We carry different brands of hearing aids and few other health products to fulfill the requirement and need of our clients.
We felt the most joy when we see the transformation of a patient's life. It's amazing to see how much joy one can achieve through better hearing.
My life is much better now with my new pair of hearing aids. I can FaceTime call to my children, and so much better than last time that I can't.
Of course, SoundLIFE was the one that actually helped me to improve my hearing. My hearing impairment improved tremendously, and I'm very satisfied with that.
Our mission is to provide hearing healthcare as a part of healthy lifestyle, to raise hearing awareness of the public, to remove stigma of the society towards the hearing impaired, and most importantly, to empower people who suffer from hearing loss to live to the fullest with the latest hearing aids or cochlear implants.
Here at SoundLIFE Hearing, we are focused not only helping you to hear better, we help you through all the aspects of your hearing health. If you have any questions about your hearing, contact us and schedule an appointment today.
Are you always filled with a lot of questions and doubts about hearing loss and hearing aids information? Hi, my name is Alleya Cheng, founder and chief audiologist of SoundLIFE Hearing. Welcome to my YouTube channel, SoundLIFE Hearing. On this channel, we cover topics from hearing loss, hearing aids products, hearing test treatments, and service to guideline on how you can have better hearing. We will occasionally also host and broadcast different experts such as ENT doctors, pediatricians, and speech therapists to share their professional insight of different hearing loss issues and solutions. Listen to the real people with real experience about their hearing loss rehabilitation journey with SoundLIFE. By sharing this testimonial from our own clients, we hope to educate and create more awareness so that you may take your first steps to getting better hearing back to your life. Subscribe and hit the bell icon for notification so that you won't miss out on our latest videos update. Don't forget to check out our how-to tips and tricks of using hearing aids properly and some latest hearing aid brands video all sort out nicely in one place. Stay tuned and see you all soon.
Pan, you can call me Pan, because in office they call me Poon because P-O-O-N. Myself is P-U-N is Pan.
Oh, P-U-N is Pan.
Pan Yu Wing. My name is Pan Yu Wing. My age is 82 years old. I've been wearing hearing aid for roughly 25 years. My hobby is actually playing with this morbok. They call morbok, singing bird. So when I go and for the singing competition, I can't hear my bird properly. That's why I've got to look for a pair because they say, hey, your bird is singing well. I say, is that so? I can't hear properly. That's why from that time onwards, I've got to get a pair of hearing aid. That was about 20 years ago. So after that, I got my hearing aid. Still, I couldn't hear properly then. That's why I've got to look for a new pair of hearing aid. That's why I came to SoundLIFE. So I can hear more clearer, and I can hear the final sound of the bird, which is very important because bird is not just singing, just like singing. They have the high pitch, they have the low pitch. You got to know all this. That's why with it new pair, I can hear very clearly. That's why I'm very happy with the new set from SoundLIFE.
Thank you, Mr. Pan, for your testimonial. So over here, I would like to send a message to all of you. As you can see, Mr. Pan have his hearing loss diagnosed at the age of 57, and since then he has been wearing hearing aid consistently from 57 years old until today, which is 82 years old. Why is so important that if let's say someone have hearing problem, they need to act earlier? One thing is that since baby time, our hearing has been active and listen to all the sound from soft to the loud sound. And for our whole life, because the hearing senses are working, our brain has been constantly receive a lot of information. However, if someone is already have some hearing problem, the information that the brain receive is much lesser, and this can actually cause the brain processing reduce over the time. The key message is that if you have hearing problem, do act earlier. And I can say that based on what Mr. Pan hearing loss today, like around 70 dB, which is moderate hearing loss, as long as he continue to use hearing aid consistently for the next few years, his hearing level could be actually maintained and not deteriorate so fast.
Well, if I were to see any of my friends who can't hear properly, I will definitely recommend my friends to come in to SoundLIFE to see you.
Hope you find this video useful. Do share this video to your friends or family who have hearing problem.
Yeah, I will definitely recommend anyone who has got hearing problem to come see SoundLIFE.
Thank
That's
you.
all of it.
Bye-bye.
Thank you. Bye-bye.
Let's welcome our speakers today. Hi, Dr. Puravi.
Hi,
Hi.
good evening. Yeah.
Dr.
Good evening,
Haniza.
Haniza.
Hi.
Good
Okay,
evening.
so good evening. So this is actually the second time SoundLIFE conduct the Facebook Live related to the balance topic. All right, and tonight we are having a different audience here. I would like to thank Miss Tan Siu Ching. She is very kind. She helped us to tag a lot of her friends to come and join this live. Thank you so much. And then for those who are in this live, can you please to introduce yourself? Are you actually an audiologist or someone with vertigo, experiencing vertigo or balance issue, or you are actually other professions? Feel free to type in the comment who are you and then where are you from, okay? And so that our speakers can also know you better and they can actually tune their level of explanation according to your level, okay? So without further ado, let me start the introduction first, okay? Our first topic is about introduction to hearing and balance. This question is to Dr. Haniza. May I know, can you briefly introduce our hearing and balance system?
All right. Thank you. Before we straightly jump to what you have asked, I would like to thank yourself, Alleya, and also SoundLIFE for having me and Dr. Puravi here today. And it's our pleasure to share our knowledge and experience with all the audience here with us tonight, and later our viewers from the Facebook and YouTube channels and Instagram, because this week is actually the so-called the Balance Awareness Week, right? Which are
Correct.
celebrated not only in our country, but the health professionals were involved in this field, but actually globally. All right, back to your questions. Can you show the figures about the anatomy and physiology of the hearing so that our viewers can understand better? And
Sure.
I
I
can
think
answer your
backstage,
question. Yeah.
our colleague will prepare.
All right.
All right.
All right. Sure.
So,
So, hearing. Our hearing is actually the ear. When we look at the ear, it has three segments: the outer, the middle, and the inner ear. When it comes to hearing, we want to focus our thoughts to the inner part of the ear. If you can look at the figures, the beautiful figures now, the snail-like structures staring at us in grey color there and labeled as cochlea. So in a simpler terms, we call it hearing organs. All right. And sitting next to it, the three loop, I would say, yeah, labeled as semicircular canals. We have three of them looking at different directions, superior, horizontal, and also vertical canals, who are giving informations for our body movements in three dimensions: horizontally, vertically, and diagonally. So the informations from the semicircular canals are actually telling when you're walking, you're running, you're rolling, bending to pick up things from the ground. All the informations are coming from the canals. And this doesn't seem not as simple as it may sound. Because what happened when we are walking in a straight line? What happened when we want to stand still? Because we need to react, our body need to react to the gravity pulls, right? So we have another special structures which are named as the otolith organs. In another picture, the one that are staring at us in grey color as well. So individually, it is utricle and saccule, but together as pairs, we name them as otolith organs. These two organs are actually telling us our whereabouts when we are walking in a straight forward and backwards, or to the left and right, or when you are standing still, so that you don't fall when we react to gravities. So, in these canals and also the otoliths, God has created us in such a way that we have microstructures in them. These canals are only very, very small, but inside them we have a special cells, we name it as hair cells, very, very microstructures. So these hair cells act as an agent, I would call it, all right, to convey to the brain via the nerve. Where's the nerve? The one in yellow is nerve. All right. So the specific nerve which connects the cochlea and the vestibular organs, we call it the eighth nerve or vestibular cochlear nerve, and it conveys the information to the brain. Which part of the brain? We have several segments of the brain. Yeah. In the third pictures, we can see that from the ear, okay, we have brainstem. It's not shown there. The brainstem is like a GPS system in our body, I would call it. Because why? GPS system is just a station where the information from the semicircular canal, from the otolith, we call it as group as the peripheral organs of the vestibular systems, and they're being conveyed via the nerve, going up to the brainstem, and then the informations also will be coming from our eyes, the vision system there, visual system you are seeing there, the gaze stability, the visual system, and also the proprioception. All right. So just take a step back. For human to be balanced, to be stable, we need vestibular organs, vestibular system, the visual system, our eyes, and the proprioception. In a simpler term, proprioception is actually information coming from the muscle, the joints, and the skin, which are telling us our body position. It is working 24 hours non-stop. We know our whereabouts even though we close our eyes. We know our whereabouts even though, suddenly in the middle of the night, you just wake up on bed and oh, I'm on the bed. I'm not somewhere else. That's the beauty of the system working together. So when the brainstem collect all this information, it is named as reflexes as well. It works as a vestibular ocular reflex, vestibular spinal reflex, as an automatic movement for human. All right. Further up, The informations are then being conveyed to the cerebellum and also the cerebral cortex for central processing. So this is how the beauty of this system works. And because God not only created the peripheral organs in one side, same with hearing, we have left and right hearing organs, the snail-like structures. Same goes with the vestibular system. We have left and right vestibular peripheral systems. They are really attached and just like living in the same room, I would say, the cochlea and the peripheral organs, the same domain, anatomically very close to each other. They are housed and protected by fluid, same body fluid, and they are connected with the same branches of the same nerve. So that's how the hearing and balance organ are interconnected in human.
Wow, very detailed explanation on how hearing and balance is actually related. Okay, so I'm sure with this detailed explanation, probably we will just skip to the next questions. Okay, anything to add on, Dr. Puravi?
As what Dr. Prof. Haniza has mentioned, balance involves
Okay.
the three organs. The important one is the inner ear or the vestibular system, the proprioception, and the eye movement rather than the vision itself.
Okay. All right. Three system. Okay. Pay attention, everyone. Later we will have a Q&A, and SoundLife is giving out 20 ringgit voucher if you successfully answer the question. So do stay tuned until the last. Okay. The next question is to Dr. Puravi. What are the most common symptoms of balance disorder?
The most common symptoms of balance disorder is vertigo. So what is vertigo? Vertigo is a false perception of motion when there is no movement. That means the patient is not moving, but they feel they are spinning. That's vertigo. There's another form of symptoms which is called dizziness. It is impaired spatial orientation, or more so they feel imbalanced. And the other ones are like vestibular visual symptoms. They feel that they have oscillopsia, where the eyes are bobbing up and down. I have a video later. If you want, you can share the video. What is a oscillopsia? Or sometimes when suddenly they move, they feel dizzy, or unsteadiness. They feel unsteady, or when they walk, they feel they are veering to one side, or sometimes they have postural related fall. So these are the common symptoms of this balance disorder.
Okay, so there is a vertigo and also the dizziness, and also one more is called vestibular
visual symptoms such as oscillopsia or movement-induced dizziness or unsteadiness, or even patients who have falls maybe can categorize under balance disorder, because one of the organ that is involved is your proprioception. So if you have sensory problem or muscle weakness, they also can have posture-related fall.
Okay, all right. Then how about some of my patients? They could be having the dizziness due to high blood pressure or low blood sugar. How do we differentiate between these two dizziness?
Basically,
Whether they are proper balance or the blood pressure.
Both conditions also can cause dizziness. However, in low blood sugar, basically they won't only have dizziness, they will have hunger, they sweat, they have heart beating very fast or tachycardia or even palpitation, or they feel shaking. So they don't only have dizziness, but they also have other symptoms, as I mentioned earlier. Regarding blood pressure, is more common in low blood pressure than high blood pressure. Patient with low blood pressure, what happens is when they suddenly get up, the pressure drops, less circulation to the inner ear and the brain, the patient can have postural symptoms. Suddenly they feel like want to faint. In high blood pressure medications, if they are on high dose of medication, that can cause drop in the blood pressure. So all these can cause postural hypotension symptom.
Okay, all right, thank you. So my next question is direct to Dr. Haniza. How does hearing loss affect our body system?
Mm. Before that, I would like to add a bit more because about the symptoms. Sometimes patients do come and complain that they have nausea problem, vomiting, and
Mm,
they feel like a sensation of spinning is quite often nowadays as well. Dr. Pravi, yeah? Sometimes we
Yeah,
do
yeah.
encounter such. And also besides low blood pressure, sometimes and low sugar levels, diabetic type 2 do have influence on the balance in human as well. And I'm not a medical person to talk about it, but years back we did a research back in UKM, and we find that some of the vestibular look at the assessment, yeah, we name it as VAMs, vestibular evoked measured potentials, are quite sensitive in detecting and pointing out there's a vestibular problems when it comes to diabetic type 2 patients. Yeah. All right, back to your question, Alia. Can you repeat again the question? I'm sorry.
yeah, no problem. My question would be, because we are audiologists, right, and we treat hearing loss most of the time. So how does hearing loss affect body balance?
Okay, how does hearing loss affect body balance? Back to what we have discussed, how the nearness of the organs, peripheral organs of the vestibular systems and the cochlea, right? Because they are very closely placed anatomically and physiologically, they are related. So when I say physiologically, meaning that they share the same fluid, body fluid, and the nerve which innervates them are the same as well. So current research has shown that for individuals with severe to profound hearing loss, who are more severe, compared to the mild and moderate hearing loss, and specifically the one with sensory neural hearing loss, means sensory loss that involve the nerve, not the outer, not the middle ear, are more prone to have balance problem, or we call it dizziness. Why? The answer is quite clear, because of the organs. So when any pathology that involves the cochlea may impinge the vestibular organs is quite clear in such a way. And the severity, for instance, if it's more severe, that it's prone to have a balance problem. And this cannot be taken lightly, because current literature also there's uprising evidence showing that for even young children with severe to profound hearing loss, if not detected as having balance problem from a young age and not given the appropriate management, might have a more what do you call that, significant problem when it comes to body balance. Mm,
I
uh,
heard that also currently for all CI pre-assessment candidacy, sometimes the doctor also requests vestibular assessment for young
yeah.
children as well.
Yes, you are right. In UKM, it's a compulsory. We have a protocol for all cochlear implantees to have a pre-assessment before the operations, and we will also have a post-assessment after the operations, not immediately after lah, like a month after the operation, after the switch on of the
Mm,
implant. Yeah.
okay, all right. Okay, so the next question we are going to touch about types and effects of hearing loss on balance. So I would like to direct this question to Dr. Puravi, which is how does sudden hearing loss affect balance compared to gradual hearing loss?
Okay, sudden hearing loss can cause severe balance symptom because the brain has got no time for compensation. Example of sudden hearing loss is like viral infection of the inner ear. We call it labyrinthitis, which involves the hearing nerve and the balance nerve. But else in gradual is more subtle because more time for compensation. So normally they don't present with vertigo. They more commonly present with imbalance or veering to one side. Example, there is a growth in the eighth nerve. We call it acoustic neuroma. So normally they don't present with vertigo. They just imbalance only. The treatment part of it is patient with sudden hearing loss with balance disorder. They will have vertigo. So you give them anti-labyrinthine sedative or anti-vertigo medication. When they have severe vomiting, then we give anti-vomiting medication. And because it's inflammation, we normally give them some steroids to reduce the inflammation. And we also advise the patient to do vestibular rehabilitation therapy. And patients who have hearing loss, we ask them to use hearing aids.
I see. So, doctor, how long they should need to wait if, let's say, when it comes to they have both symptoms, and then how long they need to wait until they can go for the hearing aids?
Basically, we advise them for 6 months. But if it is, depends, if it is bilateral hearing loss, then we ask them to use earlier. But very rarely for patients to have bilateral vestibular labyrinthitis, unless they have like brain infection, meningitis, that is permanent damage. So normally we ask them for 6 months, at least for the nerve to recover.
All right. Okay. Just to recap to our audience, hi everyone. My name is Alleya. I'm audiologist and fellow of SoundLIFE Hearing, and today I'm the moderator for tonight's talk. Why losing your hearing might affect your balance. And over here we have two speakers, which is Associate Professor Dr. Haniza from UKM and also Dr. Puravi from Subang ENT. Dr. Puravi is a consultant ENT from Subang ENT and also HMC. So over here, we will have the forum for about an hour. And then after that, if let's say there's any questions being posted, then we will have a Q&A session at the end to the speakers. So feel free to type your questions if you want to. And for those who just joined the room, feel free to also comment who are you, and then what are you? Are you an audiologist, or are you a patient with suffer with imbalance or this vertigo issue? Feel free to comment, and then so that we know that our audience, which type is our audience, and then we can adjust our depth of knowledge sharing later. Okay, so I would like to direct the next questions to Dr. Haniza. Can untreated hearing loss leads to more severe balance issue or falls? And what is the evidence supporting this?
All right. Thank you, Alleya. As we mentioned by Dr. Puravi earlier, most part of the symptoms of hearing loss, for example, for vestibular neuritis, Meniere's disease, acoustic neuroma, we have a hearing loss as part of the symptoms. And mostly they are coupled with dizziness as well. All right. Same goes with the labyrinthitis, which are quite often to happen in our community, in our country here. So if they are left untreated, it may make things worse, particularly in older populations, the elderly, and it may increase their likelihood to falls. All right, to falls. And interestingly, WHO in 2021 have published a key facts on the prevalence of falls. It seems that falls are the second leading cause of unintentional injury death worldwide. And about more than 500,000 individuals die of falls globally. In 60 years and older are said to suffer greatest number of fatal falls globally. So back to the question again. So we have to remember that hearing and balance system doesn't work in silo. It works together with proprioceptive system and visual system in human. So when an individual have hearing loss, and if they're not untreated promptly, with optimal management, that's what I meant by properly. All right, with hearing aids and whichever oral rehab, for example, then we are leaving the brain to be overburdened. That's a term, but we call it as a cognitive overload. Means the brain are working extra hours, more activities. Why? They need to first to focus. The brain needs to know what is happening. The brain wants to hear, because the hearing loss is there and not given an optimal management and interventions. So the brain will be becoming like more tired, because it needs to focus, what's happening, what are you saying, what's the cue, the surrounding noise surrounding the patients. So, and the brain attention is being switched more to focusing on the hearing tasks, and that's where the falls are prone to happen. because the attention are being channeled to one major task, which is the visual, the acoustic cues, and not on the walking and the gait pattern. That's one thing. Another thing, when it comes to younger ones, they do have like children tend to have middle ear problems, right? And for audiologists, we know the terms otitis media. For chronic cases, for example, chronic otitis media who are left untreated, or mastocytitis, otosclerosis, for example, even though they are coming from the middle ear, but if they are left untreated, it may progress to the inner ear, and this may also influence the vestibular organs as well.
I see. So, in overall, is that as earlier as you detect your hearing loss, it's better to treat early, right? So that it won't have the effect on the vestibular system. Just for everyone knowing, vestibular system is our balance systems, yeah? All right. Okay, so my next question is to Dr. Pravi. Because one of the common disease that we face is called Meniere disease. All right, Meniere disease present with the symptoms of vertigo and also hearing loss, sudden hearing loss. So how does Meniere disease affect both hearing and balance, and what are the typical treatment options?
Actually, in layman's term, Meniere disease is, we can say that's inner ear hypertension, inner ear high blood pressure. Or medical term is called endolymphatic hydrops. That means the cochlea swells up and the vestibular system swells up. So it can be either vestibular menieres or cochlear menieres. It can occur together or separately. So the commonest symptom would be episodic vertigo. That means they have severe vertigo which lasts from 20 minutes to 12 hours. That is the commonest symptom. And then during the episodic of vertigo, they will also have fluctuating hearing loss. The hearing loss will be affected, and they will have tinnitus with severe vomiting, and sometimes even have diarrhea. So these are the commonest presentation of Meniere's disease. In between attacks, they have normal hearing. However, if these attacks prolong, then they can have sensorineural hearing loss. The nerve will be affected. The treatment for Meniere's disease in acute attacks, similar like a vestibular neuritis. For vomiting, we give anti-vomiting medication. For vertigo, we give anti-vertigo medication. And because it's related to like an inner ear high blood pressure, so we also give similar advice to the patient, such as advise them to cut down on their salt, reduce your stress, stop smoking, cut down on caffeine, and stop drinking alcohol. And sometimes you also give diuretics to reduce the pressure in the inner ear. If in advanced cases, sometimes these Meniere's disease patient, they can have balance disorder. That means they can have a condition called Tumakin crisis. Suddenly, they have a drop attack. They lose their verticality and they drop, but they are always conscious. So in this kind of patient, we can give some injection to the inner ear, intratympanic gentamicin. But in very severe cases, then you might need to do surgery, which is very, very rare. But we can give option of surgery if cannot be controlled with medication, where we can cut the nerve or we can destroy the labyrinth surgically. So these are the treatment for Meniere's disease.
Wow, doctor, today only I realized that there is a surgery to do for the vestibular nerve. So if we cut, then the person will imbalance because that's how.
Because the problem in Meniere's disease, because it's so active, the brain cannot compensate. In vestibular neuritis, you have hypofunction, so the other part of the balance system will take over. In Meniere's disease, it's fluctuating, so the brain also get confused. So to avoid this, you can do nerve resection, but only the balance nerve, which is the superior vestibular nerve and the inferior vestibular nerve, which is very rare.
I see. So it's okay. I plan to ask actually, is this surgery have any risk? But I think I will just skip this because we have other questions. So another question is like, if let's say the public already experience some balance issue, like be it is a dizziness or some vertigo, so to Dr. Puravi, what are the tests that the public should go whenever they experience all this?
Basically, they have the balance testing. Balance testing, as I mentioned earlier, involves 3 organs. The inner ear. The inner ear have got 5 structures inside to control the balance. 3 semicircular canal, the utricle, and the saccule. So for the semicircular canal, we can do tests to check the function, which called video head impulse test or functional head impulse test. For the utricle and saccule, we can do WAMP, where CWAMP or OWAMP to check the function. For the eye movement, we can do VNG, video nystagmogram, to check we have 6 kind of eye movement. One is called the saccade. So if you have saccadic issues, patient also can have dizziness, or if they have saccadic smooth pursuit. If the smooth pursuit eye movement does not track properly, they can also have dizziness, or the optokinetic movements. When they move in the car, they can have motion sickness. These are all can be tested, or if and also the last one is the proprioception. This one, if we can ask the patient to do a test called stabilometry. Ask the patient to stand and see whether the patient is swaying with the eyes open or closed, or put a foam on it to remove the proprioception.
I see. But will the public straight away go to do all this vestibular system testing? Because I do understand that in Malaysia, our vestibular testing is not yet so developed like other countries. Only selected hospital or clinic offer this test. So should the patient straight away go there, or what should they do first?
Basically, they can see an ENT or neurologist to assess. Basically, most of the diagnosis is made from history. So once the patient, once the doctor gets a proper detailed history, then he will order a specific test to find out what is the cause. So if you feel the patient has frequent falls, maybe the patient might have a utricular dysfunction, which you need a WAMP to test it. If the patient has got BPPV, crystals in the inner ear, you can send them for a VNG to find out which canal is involved. So it depends on the history, what kind of test the patient needs.
Okay, but I do understand that sometimes in Malaysia, not all ENT order this test because only few clinics offer this, right? So, so if let's say like this, usually how the ENT diagnose for that condition with the place which is not having access to vestibular system testing?
So it's very difficult because if you don't have a VNG, you don't know whether this vertigo is peripheral or central. So from the VNG, we can pick up eye signs. If you have a downbeating eye, that means it's a central problem. So sometimes downbeating nystagmus, patient can present with dizziness. So a lot of findings are in the eye. So that's why we need to record the eye and observe the eye movement to find out what is the cause of the dizziness, whether it's a peripheral or central.
I see. Okay. All right. So over here, we do have Dini, a postgrad audiology student from UKN. Hi, Dini. Okay. And also Fatima, audiologist. And also some comments from Ray. Over here, Ray got one question, but I will post it later. And then there are also some comments like Jising mentioned that many kids nowadays having problem of otitis media. It's true. And then sometimes if without screening, I believe they will gone untreated also lah. And then we also have Stephen Christopher Gomez, which is a comment about great sharing, and he has helped to share this talk to his Taekwondo friend. Yeah, so Taekwondo is also one of the risks because they move differently. All right, so next question is that to Dr. Haniza, what are some common diagnostic tests used to assess both hearing and balance function?
All right. I think Dr. Puravi has also, covered that quite, quite extensively. But I can just share from what we have do our common practice in my clinic in UKM. I've shared some pictures as well. From the pictures, if you can just show to the audience, Anis. Yeah. So in our clinic, we see the patients that we see covers from as young as 6 months for vestibular and balance assessment. As long as the child has a good neck support, we're able to conduct the things that the testing, which are VHIT, video head impulse tests. The pictures are not coming out. I don't know why. And also the VEMS, vestibular evoked myogenic potentials. Shall we wait for the pictures so that I can explain more from the pictures for the audience to see and understand? Yep. So from the pictures, if you it's quite bad, yeah. Okay,
Yeah,
that
I
one.
think the line is a bit bad.
All
It's
right.
okay. You can
All right.
continue.
There are three pictures. There are three pictures there. The one on the left with me wearing the blue scarf there and holding the child's head is actually we call VHIT, video head impulse test. It's a very quick test, but it's very powerful test in terms of it's able to tell what's happening to the three semicircular canals on the left and on the right of the head. Besides that, besides the canals, we also know the nerve status, which innervates all the six canals, yeah, in the left and the right. So for that, we can conduct the test as quick as less than 5 minutes in as young as 6 months old or 4 months old child, as long as the child able to sit quietly, able to cooperate, able to open their eyes, because we need to see the eye movement, as what Dr. Puravi has been mentioning again and again. The eyes is actually the window of what's happening in the ear, of what's happening in the semicircular canals. All right, see. So other than that, for the otolith organs, we have two special tests. The upper side is actually the CVEMs for the saccule and the nerve which innervates saccule, and the lower bit is the OVEM, ocular VEM. It's for the utricle. So all these are being conducted in most of the clinics who have the vestibular assessments. We also do the same test in adults as well. Other than that, for proprioception, for the second pictures next to the where the child is standing on the foam, if you can show the next picture, please. Yes, that one is essentially what you call that, cost effective or cheap test, I would say. Not we don't have the posturography, which are quite expensive, I would say. But in our clinic, we adapt two tests, which is the PCTSIB in children, or in adults we call it MCTSIB. And for the left pictures and on the right is part of the BOT test, BOT 2 test. Okay, when for the left pictures, if you see the child is standing on a foam. Okay, for the test, we have several sequences. We're asking the child first to stand on the floor with hard surface, with eyes open. So with eyes open, hard surface, meaning that the brain is receiving information from the vestibular organs, if it's intact, from the eyes, the vision, and also from the proprioception, from the feet, from the muscles, right? So then we time how long can the child stand. 30 seconds is at least for 30 seconds, and we say okay, that's fine. And then we ask the child to close their eyes, still standing on the hard surface on the floor. That's where we are taking the information from the visual system, and the child needs to rely, or the patients, adult patients, needs to rely solely on the vestibular organs and also the proprioception. Then we time them again. Next, a more difficult one, we ask the patient to stand on the foam. It's where we are taking the proprioception information, and the patient needs to rely solely on their vision and the vestibular. And then the final one of the sequence of the test, which is the most difficult, we ask the patient to stand on the foam with their eyes closed. So from three informations that our brain is receiving, which is from the vision, proprioception, and visual, now eyes closed, vision is gone. Standing on foam, proprioceptive is gone. So the brain has to really rely on the vestibular organs. So if it's not there, it's not intact, then we can see that the child will, the sway will be a bit wobbly, and that's why we time, and we are able to see how much swaying does the child make to see whether it's significant or not. Significant sways would be about more than 5 degrees to the left or to the right. That's significant sways. As for the BOT bot 2 test, it's part of it. Like we ask the child to walk in a straight line, and then throughout the corridors, and to stand on a, what do you call that, on a beam, that's where, on the beam, and we chart how the gait patterns of the child is. So, and yes, as Dr. Puravi has mentioned, I don't have the pictures there, but we do have video nystagmography, VNG, whereby we give visual stimulations to the patients, in front of the patients, about 1 meter or half meter away, depending on the systems that we use in the clinic, and a different visual stimulus pattern, and they need to follow the instructions given by the clinicians on duty. So that's where the beauty lies, where the clinicians are able to differentiate whether the pathologies are coming from the peripheral organs or from the central part. So VNG is not to be taken lightly. For any clinic who wants to be equipped with vestibular assessments, needs to have VNG as well for more extensive and thorough diagnosis.
Yeah.
And don't forget, the most powerful tools that we have and need to do it confidently, and it comes with the experience and history taking for all patients. Clinicians invest time, as Dr. Puravi has mentioned. History is very, very important. We as clinicians should invest our time to dig more informations from the patients or from the caretakers of the children, to know actually the underlying problem, the history, to bring back their thoughts. Not because vestibular problem doesn't happen in overnight. It doesn't happen within a week. It might happen much, much earlier. For example, in trauma cases, accident, for example, being hit in a car accident, which eventually doesn't happen. The problem doesn't happen overnight. It can happen years later, and we terms it as BPPV, benign positional vertigo. So all these things, sometimes if we didn't take our time to probe the patients and ask them questions, they might forget, and we cannot
Correct.
classified as idiopathic, unknown reason for things to happen.
Yeah. All right. Very details. And don't forget, for hearing system, usually we need to perform the pure tone audiometry test and also the tympanometry test.
Yes,
All right.
thank you for mentioning. Can I add a bit more? Okay,
Sure.
with hearing, normally most of us are quite aware with hearing tests. For
Yep.
adults,
Correct.
go to the clinic and ask the patient to wear headphones, not this one, a special kind of headphones. And we
Yeah.
ask the patients to listen to a specific tone, and we ask them to press the button to the tones at different frequencies, different sound quality, low pitch to the high frequency sound, right? So with advancements in technology, actually vestibular systems, the assessment has covers from low frequency up to the high frequency as well. There are pictures as well to show about the frequency of vestibular testing. If you can show it on the screen, please, Anis. Different pictures for the frequency spectrum of the vestibular system.
Okay. Um, is this one?
Yes, thank you. The frequency
Yeah,
spectrum of the
full slide,
vestibular
full slide.
system.
Okay.
Yeah, that's correct. Yeah. So the frequency there shown on the screen on the axis, the horizontal axis, is actually not the same frequency as the hearing test. When it comes to frequency of hearing test, it implies the quality of the sound, the pitch of the sound. When it comes to body balance and vestibular system, is actually referring to the frequency of the body movements. So from the lowest frequency in the diagram, it is like 0.001 hertz, which is very, very slow. Human doesn't move that slow. Even sloth, the cute sloth, that not in our country, it's found in Australia. It doesn't move that slow, I would say. So, but we have a special test. We name it caloric. It's not being shown in the earlier pictures. Yes, but advancements, we have a rotatory chair there in the middle, which covers the low frequency and mid frequency range. And then we have the V-heat for the high frequency. And now we have a new test to the right. We call it vint, the new vibrators. So actually, the rotatory chair and V-heat represent best of the human movement. moment. So that's why most of the clinic, I believe, are focusing more on VHIT, because rotatory chair costs, I was being told now, cost more than $500,000. It's just like Ferrari, more than expensive than Tesla in our country, yeah, because our,
Wow.
so that's why I always address it in such a way. Yeah. So I hope it's
Yeah.
clear. Yeah. Yeah.
Yeah, very detailed. Thank you. Okay, let's move to the next section. We are going to talk about specific condition and their impact. Okay, so this question is to Dr. Puravi. Other than vertigo and dizziness, what are other symptoms of balance disorder?
Yes. There are many other symptoms of balance disorder. Some patients, what they have is where they have light-induced dizziness, or we call it as photophobia. Some, when they hear sound, like horn sound, they feel dizzy. It's called phonophobia. Some have a smell-induced dizziness, especially perfume smell or cigarettes smoke smell, they feel dizzy. It is called osmophobia. Some patients also have a movement-induced dizziness, which is called as kinosophobia. And some patients, when they see action-packed movie, they feel dizzy. Or some patients, when they walk on a mosaic floor, they feel dizzy. Or when patients go to supermarket, they feel dizzy. They call this as a supermarket syndrome because of abnormal optic flow on the right and left. They cause them to have dizziness. And I have a patient who had actually, when he was driving in the highway, he feels his car is veering to one side. That means it's going to the side. So he went to see 3 mechanics to check whether it's a car problem before came to me. So it's actually is a kind of condition where they have motorist disorientation syndrome. And sometimes patients who go on a like a boat, a ship, they can come back from the cruise, they feel dizzy, Mel-Dick-Bachman syndrome. We call this kind of syndrome. And the other symptoms would be they feel the room is tilted 90 degrees, 180 degrees, or they have Alice in Wonderland syndrome where they feel their hands are big, their legs are small, a very bizarre pattern they can present. Or sometimes they can have aura or scotoma or zigzag line. So there are so many other presentation other than vertigo and dizziness. So these are the common symptoms. Like this picture, you can see they see the stop sign as spots or the other way around, or blurred vision, and they can have hollow or scotoma.
Okay, so all this is and also one of it is called motion sickness also, right? Is motion
Yes.
sickness under balance problem?
Yes.
Because I recall
Now,
myself last time when I went for snorkeling, then it's just like floating. Then when I'm back, I also when I stay, I also see the room is spinning.
but in the ocean or in the sea, when you what happens is that you lose your proprioception. Okay, but motion sickness normally occurs in the car, or so what happens is motion sickness can be an early symptom of vestibular migraine. So they have done studies shows that many patients with vestibular migraine actually have motion sickness.
I
It's a problem in
see.
the utricle or saccule.
I see. Okay. All
Or
right.
maybe Alia
So,
might be experiencing a temporary barotrauma because of you went scuba diving or snorkeling. Maybe you jumped too
snorkeling.
hard.
No, it's not jumping, it's just snorkeling. And I still remember the first time when I learned how to snorkel. I mean the life, we need to wear the life jacket, and then the coach is actually asking us to lie down and then flow and flow. Then when I back home, the first incident I experienced is like when I was Form 2. So it was a camp. Then I see my whole camp is moving. I do admit I have a very weak vestibular system, so I depend on the visual and proportionally receptors to actually overcome it. So,
Alia,
Dr.
do you have
Puravi, what is
headaches?
this about?
Do you have headaches? Headaches?
No head.
No. Okay.
Yeah, okay. So, how about this one? The pictures, Dr. Puravi.
These are
Saying
all other
hello.
symptoms. Hello, sir.
Other
Whether
symptoms.
in especially in migraine, because migraine can be either pure headache or they can also present with dizziness. Many vestibular migraine patients might not have headaches at all. They present with dizziness. So the treatment is different Most of these patients, if they give vertigo medication, they won't respond with vertigo medication.
I see. I see. All right.
That's why,
Okay.
as what
So,
Prof. Haniza said, history taking is the most important thing in vestibular medicine. History, all about history.
wow. Okay, must have a very detailed history. Then only we can at least knowing which one. Then we decide what test to do to test
True.
on them.
And
All
also
right.
to manage the patient. Yeah.
Yeah, true. So next question is to Dr. Haniza. What is the relationship between tinnitus and balance issue?
Okay. Tinnitus is actually a ringing in the ear, right? Most of us, it's common to experience at least once or twice tinnitus in our life, for different reason. But as long as the tinnitus doesn't really, prolong and affect our daily lives, then that's okay. When it comes to tinnitus and vestibular or balance problem, because both, tinnitus has to do with cochlea, the inner ear. Vestibular has to do with the vestibular organs in the inner ear as well. So that's how they relate. And most of the pathologies that involve the inner ear, for example, Meniere's disease, vestibular neuritis, they have common symptoms of tinnitus or ringing in the ear and hearing loss and also vestibular problems. That's how it goes, how it ties. I don't want to touch much about tinnitus. That's because that's not my expertise. But one thing I would like to highlight is when patients who have prolonged tinnitus, it may affect their psychology, and also there may be anxiety. That's how it is. It can make a balance or balance problem worsen in any individuals, because that's a term we call it as anxiety related vertigo. So when a patient becomes psychologically distressed, they feel anxious, they cannot sleep well, it may affect their balance problem. So how it's really, when we can look at that in a bigger picture in a way lah. Alright.
All right. Okay. So don't forget to seek help if you experience any of the symptoms. Okay. My next question would be to Dr. Puravi. As we know that the most common vertigo is called BPPV. So can you briefly explain what is BPPV, which is benign paroxysmal positional vertigo, and how does it differ from other types of vertigo?
As what Prof. Haniza mentioned, we have a linear sensor in the inner ear called the utricle. The function of the utricle is to detect whether patient moving forward or backwards, sideways. So inside there, we have calcium carbonate. So what happens due to aging, this calcium carbonate gets detached and enters into the semicircular canal. You can see on this video, the calcium carbonate gets distilled. This is called the crystals. So when it enters into one of the canal, this canal become gravity sensitive. So when the patient starts to lie down or position, so in this patient, you can see the patient, when it lies down, so the patient is lying down, you can see the particle is moving. So this become gravity sensitive. When it becomes gravity sensitive, the copula gets stimulated, action potential, and cause the VOR or eye movement. You can see the patient having nystagmus. This is presented as vertigo. When they see the whole world is moving, the patient presents with vertigo. So it is different from other vertigo is because it's only lasts for less than a minute. It is benign. It is position related, and sometimes can associate with nausea.
Yes.
For basically BPPV is to identify where is the particle. We have total of 6 canal. So more than 14 variants of BPPV. So treatment depends on which canal and which side. If it is involved in the posterior canal, then the treatment is you have to do a maneuver test to diagnose where is the particle, and then you do a maneuver. So posterior canal, you at least maneuver or Sermon's maneuver. If it's a lateral canal, then you have many maneuvers. Zuma maneuver. I have some of maneuvers. If you want, you can share the video.
Yeah, Zuma maneuvers.
Zuma maneuvers or Gofoni maneuver, Appiani maneuvers. There are so many maneuvers. And if it's the anterior canal, we can do a Yakovinos maneuver. Again, the maneuver is the only treatment for BPPV. There is no medication and it's very, very successful. Sometimes patients have more than one crystals, they have multiple crystals, so the patient need to do the maneuver 2 times a day at home. Initially, it's done in the clinic, and then the patients are asked to do the maneuver at home 2 times a day for 5 days and come back and reassess. So again, maneuver is the only treatment for BPPV. It's very effective. It's called
I
a
see.
Zuma. Basically, what we are doing is we are removing the particles from the semicircular canal into the utricle bag, and it
I
gets
see.
dissolved in the utricle.
So, doctor, I also know that there is one maneuver. This is called Zuma maneuver. We also know that there is one called Apley maneuver. So, how is it differentiate from each other?
Apley is for different canal. It's the posterior canal. Zuma is for the lateral canal. So that's why we need to do a VNG specifically to look at the eye movement. You put the patient on we call it the disc hall pipe test, and then when we do the disc hall pipe test, we look at the eye movement. If it moves upwards and towards the right, then it is the right posterior canal. If upwards and to the left, is the left posterior canal. If it's downward, then it is the anterior canal. So by doing the test and looking at the eye movement, we can detect where is the particle and which side is the particle, so we can give the appropriate maneuver for the patient.
Okay, all right. So, to audience, don't maneuver by yourself by just watching YouTube. I know that nowadays we have a lot of resources online. Better seek for the professionals and then let doctor assess which one you need. Okay. So the next questions to Dr. Haniza, how vestibular rehab can help patients with vertigo in general?
Okay, thank you. Vestibular rehab is actually vestibular rehab exercise. We call it, or VRT. It's a specialized exercise. It's more effective if the exercise are being done by someone who are able to understand and appreciate the vestibular assessment and able to understand how to integrate the results, or even better, how to interpret the results. In a simpler terms, they know, okay, where's the problem actually coming from. That's how we call it a more targeted vestibular rehab exercise. Because nowadays is in our country, the problem now is not many professionals know how to conduct vestibular targeted exercise. Most common that we found ones are giving just a general exercise, and unfortunately it may make the symptoms worse.
Oh,
It's the
okay.
same as all the applies or maneuvers, the maneuvers that Dr. Puraviappan has been explaining. If people just look at it and do it and they learn from YouTube, they might cause the crystals to migrate from one canals to another, and they might make things worse. So what's important is for professionals, we ourselves as professionals, and I hope our friends who are listening now, we need to equip ourselves and to learn not only the assessment but also on the rehab. Okay, when it comes to vestibular rehab, children and adults, they have different kind of adaptation and habituation ability. Depends on the brain, depends on the age of the vestibular system. In adults, when it comes to hearing loss, we often say to our patients we use the term presbycusis. But when it comes to aging vestibular system, there's a term we can call it as presbyvertigo. So when it comes to aging vertigo or presbyvertigo, or to young children, there are different exercise that can be done according to the needs and complaints or signs and symptoms of the patients that we're seeing. The concept of RT goes back to we want to instill and compensate for the loss that is being faced by the patients. We want the to habituate, to relearn the process. and there are special exercises for the symptoms they are facing. For example, they need to, learn to rebalance themselves back, to walk in a specific gait pattern, and we want to train the visual system back so that there's not overload by the visual system. The simplest thing when Dr. Puravi was sharing about the supermarket syndrome, when patients are walking, normally they complain that they have vertigo when they walk in a busy corridor in a supermarket. Busy corridor, when they're walking, for example, in a busy mall, and then they have a few people, passing across them, walking across them, and in opposite directions, right? Opposite directions. That's where we call it as visual overload. And when the systems are not working well, the vestibular systems, the brain, relying more on the vision to know their whereabouts, to keep them stable, because the vestibular systems are not functioning 100%. So visual overloads happen, and that's why vertigo or dizziness really, is really bad for the patients. That's one example. Same goes with the floating sensations that the patients are facing as well. So when it comes to vestibular rehab therapy, when the clinicians needs to identify the problems and give a specific homework of exercise, they come to the clinic and train them and ask them to do it, once or twice a day for several minutes, and we need to chart their progress over time.
I see. So how long is the duration will last for this vestibular rehab in general?
It depends on the age of the child. It depends on individualistic.
see.
Not one exercise or one timing fits for all. It depends how religious the patients are doing the exercise, how tolerant and adaptive their body functions, their brain is. Yeah, it's not direct.
It's not well, under your case is that how long would be the course like for a patients who went to you, and then from the diagnosis then you already start to prescribe exercise, vestibular rehab exercise to them.
We
So
train them.
yeah, you train them. So how soon they can be like discharged from your cases? Yeah,
Sometime
from
1 month, sometime more than that. But we have to bear in mind that balance problem may reoccur later. We don't really know. It can just suddenly can happen. Always like in PBV cases, sometimes it can just reoccur again. Or sometimes they can reoccur because maybe previously they have BPPV history, and then suddenly they have Meniere's disease or vestibular neuritis, and suddenly it just can be coupled back with the BPPV. So we don't really know why. Maybe the fragility of the ear structures, and that's how it happened. So when it comes to exercise, yes, it depends. Because I have quite recently, I have patients who travels all the way from Ipoh. She wants to come to Jalan Temelo and see. She's in her mid 70s. I call her auntie lah. So I am happy. Her daughter always in contact and text me to tell that after a month, I train her to do the exercise that Puravi has been sharing just now. Her mother improved. Because she is, she's been following the regime and really following our advices, and within a month she's clear of the BPPV. Yeah.
Okay, all right. So over here I have a few videos because just now that due to technical issue, so I have a video about this others balance symptoms, which is the oscillopsia video. So let's take a break. As a speaker, we take a break and then let's watch the video for a while. And then meanwhile, Dr. Puravi, feel free to explain it.
This is where the patient, we call it vestibular visual symptoms, where the patient has oscillopsia. So I had a patient who actually had dizziness. It's called dizziness. So this patient was treated with medication, vertigo medication, and patient did not respond well. So the cause of the oscillopsia in this patient was patient had bilateral vestibulopathy. That means the both vestibular nuclei is affected due to microangiopathy. She had severe poor control diabetes, which caused microangiopathy to the to the midbrain, causing to her to have
See, so
vestibular.
meaning for those like who is having existing diabetes patients, for those existing diabetes patients, if they don't control their diet well, they may have this.
No, this is a very rare
Oh, very
incident. Actually, this was an ophthalmologist. She never complained that she has oscillopsia. So
Oh.
she complained she feel dizzy. She has seen 3 neurologists, and all of them have given her medication, Betacert. This is a very common drug used in vertigo. So she came to me walking with a slow gait, very slowly she was walking. So I took a history, but she never mentioned she has oscillopsia. Then when we did the reheat, we found that all the canals, because compared to what Prof. Haniza just now said, that the rotational chair is very expensive, but only can test for 2 canals, the right and left lateral canal. Whereas the reheat is a 5 minutes test. We can test for all the 6 canals. So when we did the reheat, she had poor gain in all the canals. Then this is vestibulopathy. Then I asked her, do you have oscillopsia? Then I showed the video to her. This is what I have, she says. So you see, even an ophthalmologist don't know what is an oscillopsia. How do you expect our normal layman to understand? To say that, oh, I have oscillopsia. They only can complain dizziness. So with the test, we can actually identify what the patient really had. So in this patient, what we actually did, ask her to stop all the medication. Basically, the labyrinthine sedative should never be given to this patient, number 1. Number 2, this patient needs basically vestibular rehab therapy. And the patient at night, because now the vestibular function is gone, left with 2, the vision and the proprioception. So in the house, we ask her to remove all the carpets from the house, because when she walks on the carpet, her proprioception is gone. So this patient has high risk of fall. So at night, she goes to the toilet, ask her to on the light. So these are the things you have to advise the patient.
Yeah.
Okay, right, interesting. So we have also another video which is called visual vertigo.
So sometimes this motion sickness, when they see something moving, the patient can feel dizzy. Okay, and
even
then
quite confused. All right. Okay. So even like just now, Dr. Haniza mentioned about the narrow, busy corridor. It's also the same, right? Because it's an overload from the visual.
Yeah.
So we have a next video. It's actually called blurring of visions. So
blurring of vision is basically your VOR function not working well. The VOR function.
Okay.
These are features of in vestibular migraine. They can feel blurring of vision. Sometimes they see aura or dots. They can feel, or halos, we call it. These are the symptoms some of these patients will have. Especially if you diagnose the patient have vestibular migraine. This is all the halo sign or the aura they have.
I see. So this equipment is like they are stimulating the vertigo for the patients and see how they feel, is it?
Yes.
All right. Wow. Okay. I just looking at the video, I also feel dizzy. So then those who suffer from vertigo, they can really feel suffer if not treated properly. All right. So I suddenly have one question. It's a pop-up questions. So how is blind people feel then? Because blind people, they don't really depend on the visual, right? They only can depend on the vestibular system and also our proprioceptal system. So how would they have vertigo? Because they don't have.
A blind patient, because vertigo, actually we have 2 types of vertigo. One is called external vertigo. Another one is internal vertigo. External vertigo is when you see the whole eye is moving. Okay, so in blind patients, they cannot have vertigo in that sense. But if it affects the inner ear, the vestibular neuritis, they can definitely have vertigo.
I see. All right. Okay. So today is also new thing for me. I just learned that we have external and internal vertigo. Okay, let's move to the next questions. This is actually to Dr. Puravi. Can medication cause dizziness, and what are the common one?
Oh, many medication actually can cause dizziness lah. So there's a long list. Most
Long
common
list.
ones are ototoxic antibiotics lah. Are seldom used now, but this can cause, the aminoglycosides can cause, and anti-TB treatment sometimes can not only cause vestibular toxic, but also ototoxic, can also cause hearing loss. Many patients those days on streptomycin had actually hearing loss plus dizziness lah. The other things are chemotherapy, especially they have a platinum component. Chemotherapy, platinum is a common cause of hearing loss with dizziness. Other than that, it'll be the epilepsy medication like anticonvulsant or antidepressant. Nowadays, for mental health, a lot of doctors are prescribing antidepressants. So we must be very careful. This can be a side effect of the medication, antipsychiatric medication. And the other one commonly patient use is antihistamines, which is the first generation, which is a very sedative one. The first generation is cross the blood-brain barrier. So they are sedative. They are more prone to get all this dizziness, drowsiness. Other than that is the sleeping tablets can also cause this. Or high blood pressure, if you higher dose of hypertensive medicine can bring down the pressure and patient can have postural hypertension, which can
I
cause...
see. So, all right.
imbalance.
Okay. I see. Okay. So, which medication? Go back to your doctors. If let's say you are suffering some dizziness due to medication, go back to your doctors and inform them. So probably the doctor can prescribe another type. So I have the last 3 questions. Okay. All right. So this one is about living with hearing and balance issue. Questions to Dr. Puravi as well. Can vestibular or balance disorder affect cognitive function, or we call it brain function?
Definitely, it can affect the cognitive function because the vestibular pathway, as what Prof. Haniza mentioned, is connected to 6 systems in the brain. That means from the semicircular canal and the utricle saccule, this goes to the brainstem where the vestibular nucleus is there. From there, it goes to 6 pathways. One is to the eye to get visual stability. Another one, it goes to the spine muscle to get postural stability. And then it goes to the cerebellum to get the fine motor control and coordination. It goes to the autonomic system to control the autonomic function. It goes to part of the brain. One is to the cortex or the PIBC where the cognition function. Another one, it goes to the hippocampus. It's important for our spatial orientation, or it's also called as the GPS of our body. So if you have problems in the vestibular system, definitely it can affect the cognitive function. So what do you mean by, what is the meaning of cognitive function? People, we talk about cognitive function, but we really must know what is the meaning of cognitive function. Cognitive function is basically mental processing. So it involves first perception, all the input, and then we acquire knowledge, and then we try to understand, and ability to recall and store as memory. So that you can solve the problem. With this information, you can recall and solve the problem. So this problem solving is called executive function. And with also it is important because through the hippocampus, so it has got spatial orientation. It can be affected. So in patient with chronic balance, they will have poor memory, as I mentioned, because one of the component of the cognitive function, poor orientation, which cause the patient to have high fall risk, and also the patient can have depression and even can have dementia in long term. So in summary, it cause poor quality of life.
Yeah, so don't underestimate any balance issue that you are currently facing. Do seek help as soon as possible. That's the insight that I got from Dr. Puravi and also Dr. Haniza sharing. So we go to the next question to Dr. Haniza. At SoundLIFE, we as an audiologist always encounter elderly patients with hearing loss associated with or without the balance disorder. So normally our normal practice is that after we diagnose them with hearing loss, we will prescribe them with the hearing aids as our treatment of hearing loss, right? But Dr. Haniza, do you really have any data that can show, or even like science paper that can show how would hearing aid also helps to reduce balance issue that may be coming afterwards, or even like associated with the hearing loss? If
Okay.
so, then
Okay, thank you, Alleya. That's a very good question and very relevant because most of our audiologists are working in hearing centers, right? So first, normally in the older days, I would say, when I was like much younger, when we say about hearing loss, we always think about hearing aids, about helping the patients to hear, especially, in children, in adults, in elderly. Second, we always think of hearing aids as to increase or give the most optimal quality of life for our patients, for them to live daily. But the rising, what's coming up now is the understanding of most professionals, and we need to instill the knowledge in our patients is that with good hearing, we are trying to preserve their memory. We are trying to delay and avoid dementia to happen, especially in elderly patients. As Dr. Puravi was saying, and I did mention earlier as well, we want the cognitive to be, our brain to be stimulated all the time. You want the brain to think, to work. So that's where hearing aids are important in hearing. As for balance, we want to take away the brain to be too busy. We call it cognitive overload. Too busy in trying to figure out what is the sound coming, to understand or comprehend the speech coming in, the speech stimulations, the conversational partners in front of you, what are they saying, or just as simple as surrounding sound, the birds chirping. If the brain cannot comprehend what's that, it becomes busy and you become distracted, which is emotionally you are tired, concentrating are much lower, and your brain also are busy thinking about the sound. So all this cognitive overload or burden can easily, or we can, as an audiologist, we can do by prescribing hearing aids to the patients, the right hearing aids for the patient's needs. And we need to explain to them that why they need hearing aids, because most of our elderly, for example, the ones, maybe our family members doesn't like to wear hearing aids because it's not comfortable, they would say. And of course, the quality of sound, they need time to adapt to the sound that they're hearing with the hearing aids, right? So we need to tell them that no, it's not only about the sound. We want you to be cognitively healthy, to avoid dementia. We want you to, to have a good balance system, to avoid falls, because it goes back to the concentrations of your walking, of your gait.
okay, yeah, that's a very good point. Thanks for your sharing. So I have the last questions to Dr. Puravi. For patients who did not access to vestibular rehab exercise, just like what Dr. Haniza had mentioned, what would you advise them?
Basically, the most commonest one we give physical therapy. Basic physical therapy involving strengthening the muscles. So we ask the patient to do like Tai Chi or yoga or even Pilates to strengthen the core muscles. Very important. Or some patients we encourage them to engage in dancing activities. There's so many dance
Dancing.
schools, yes. And all this is important because to increase their long-term potentiation, or also known as neuroplasticity, is very useful for them to build up new connections. And for cognitive function, normally we assess the patient by some questionnaire, which is called the MOCA, or Montreal Cognitive Assessment. So, and here, if to improve their cognitive function, we advise the patient to do readings. Now I start giving patients also puzzles or Sudoku, simple Sudokus to solve before they come for the next follow-up. Okay, and ask them to acquire new skills, like if they were interested in music, they can learn musical instruments.
Okay.
So
Wow. Okay. So Sudoku also helps, huh?
Yes,
Today I
all the-
learned. I thought all it must be the moving exercise. So Sudoku is just
Sudoku is for
the brain.
Exercise. Yeah.
Brain
Brain
exercise.
exercise.
Okay. All right. So just now I forgot to ask you one question, Dr. Haniza. How about children? For those like children with maybe hearing loss, do they also develop balance disorder? Young children, I mean.
Young children, yeah. So it comes to young children, I would say that most of them are underdiagnosed. It's not only in our
Oh.
country, worldwide. Why? Simply because they don't have the vocabulary to complain. They don't tell. They don't know that they have a vertigo. They don't know that they are dizzy. So it goes back to how sensitive or how observant the caretakers that the parents are. So as parents, we need to be, to observe whether the child is appears to be clumsy as in the sense of easy to falls, even suddenly running, not like a uneven surface. It's just like a normal corridor, for example, on a field, stable field, tapi suddenly the child falls, stumbles easily, or prone to walk to one side, veering to one side, or prone to like when walking, and then suddenly the child needs to stop and just to stabilize, hold herself to the wall. Actually, I have a very interesting videos of my patients, but I can't share it because of confidentiality reason lah, because it's a video. We can see her face. Yeah, but from that video, it's very, very clear that when she walked, like for example, about 3 to 5 steps, she needs to stop and just she needs to lean herself to one side to the floor, and she keep on walking, and then she just stop after 3-5 steps, and then she needs to lean again to one side. So it seems that she needs to rebalance herself. When I show the videos to during CME to my fellow speech fellows and audiologists in UKM, they suddenly it pops in their mind, oh, I have patients or like that. Sometimes the small things that we observe might triggers and might raise questions in our mind whether the child needs to be assessed for vestibular assessment or not. Another thing, most of the children nowadays are very addicted to gadgets.
Yeah.
Many hours, too long hours on gadgets, which may cause them to have visual problems, unchecked visual problems, and may cause them to have dizzy problems, undiagnosed dizzy problems. That's another issues. That's another topic that will, we need another hour to discuss on that as well.
Okay. All right. I also learned that. So may I know, are all children or is there a age there whereby below this age, if they still appear with like clumsiness, it's okay. Maybe it's not due to the balance issue, or is there a cut-off point like that? Like for example, elderly, usually we say that if above 60 years old, you appear with all these 10 questions, the screening question of hearing loss, you appear more than 3, then you should have your hearing checked. Is there something like this for us to, identify young children who might be having the disorder, balance disorder?
There's a checklist. We call it like a vertigo symptom scales lah. In children, PVSQ, pediatric vertigo symptom scales, whereby if children are not, for younger children who are not able to read and write, the caretakers can fill out for them based on their observations. But their checklist, whereby we can determine the as you said, whether the child prone to falls, appear to to be dizzy, or nausea, vomit, and whatnot.
All right. Okay. Thank you. That's all for our forum questions today. So I have few questions from the floor. So let's answer this one. Okay. Hi, doctor. 1 year ago, I got sudden hearing loss and with my left ear, and together with the vertigo at the same times. So the patient, this customer did not really inform what is the question they want to ask. Okay, but I think maybe Dr. Puravi, you want to answer this one? Is this common?
Basically, this kind of 2 things here you have to say. This patient has hearing loss with vertigo. it is sudden onset. So either it can be labyrinthitis or iCar stroke. So I want to know whether the patient has got hypertension, high cholesterol. So these are the important thing. If somebody has got a sudden hearing loss with vertigo, we must always consider a stroke. This is the artery, the anterior inferior cerebral artery. One of the branch goes to the labyrinthine. It's called the labyrinthine artery. So for this, normally, how do we know? We can do some clinical bedside testing. We call the HINS testing, head impulse test, skew deviation, and look for nystagmus. So if only unidirectional nystagmus, is very unlikely to be a stroke. But if you have a downbeating or upbeating or gaze evoke nystagmus, that means bidirectional, then it can be a stroke. So from this patient, Roy, most likely it is looks like a labyrinthitis. Most likely, I need to get further history before I make a diagnosis. So basically, this patient, normally the vertigo will improve. The hearing might not improve in labyrinthitis. If it is either the labyrinthitis viral or bacterial again. If it is viral, there is some chances of improvement. If bacterial, will not improve.
I see. All right. Okay. So, and the sudden hearing loss is different from the idiopathic sudden hearing loss that we mentioned. We always encounter, right? Which is that one is without the presence of balance problem.
No, idiopathic hearing loss just involves cochleitis. This is labyrinthitis. Okay. So that one can be due also virus herpes simplex virus can just affect the cochlear nerve itself.
I
see. Okay, thanks for answering, doctors.
Yeah, I did add on a bit.
Sure.
Not about Roy complain Roy no more complain. Because Dr. Puraviappan mentioned about the possibility of stroke and sudden hearing loss and vestibular problems. Just a bit on that, because previously Dr. Sharifah Zainun, she was my PhD student and now working in HPKK Hospital Puan Azizah. HPKK in KKM. So she did for her PhD study, she did a comprehensive thesis research project on stroke and influence of stroke on vestibular and balance findings. And we found very interesting when it comes to, as Dr. Puraviappan has been mentioning about iCar stroke, cerebellar stroke, brainstem stroke. It may cause dizziness, of course, the complaint, and sudden hearing loss. And interestingly, the things that I want to highlight here is VNG and VHEAT and also VAMS do have give a significant results when it comes to stroke patients. So of course, this is why we need to depend on an MRI and CT scan as well when it comes to diagnosis of stroke. But what importantly, we can also see the more cost-effective and non-invasive vestibular assessment, call it in that we have in are able to diagnose the stroke, and they are very sensitive as well with the good results. Yeah.
See, so meaning to say that but which one will come first? Will their stroke come first, or will their hearing loss come first? Sorry, not hearing loss, the stroke come first, or the dizziness or balance complaint come first?
It depends if from what we see from the study, if the patients have a high blood pressures, of course it will most of them complain with dizziness and headaches and whatnot. But suddenly, if it just happen an acute stroke, normally it just a stroke, and then we call it the dizziness comes later.
So both may actually. Pardon?
Am I right, Dr. Puraviappan?
No, basically all these are posterior circulation stroke whatever it is. So they will have severe. Their main symptom will be vertigo. Their main symptom vertigo. They might not have weakness, but they will have ataxia when they can't stand up and walk. So we have to, as a clinician, we have to differentiate whether it is labyrinthitis or stroke. So one way is to do an MRI, but MRI is not 100% also. You can only about 88%, because acute stroke MRI cannot pick up everything. So what we do is simple clinical test we can do called the HINS test, HINTS hints test, head impulse test, and you look at the eye skew deviation and also nystagmus. HI for impulse and for nystagmus, TS for skew deviation. Now they have hints plus also check the hearing. So this is basically will tell you whether it is a stroke or it is a labyrinthitis.
All
That's
right.
to differentiate
So the
between the two.
presentation will be acute onset of vertigo with vomiting.
I see. All right. Thank you. Thank you both doctors for your detailed explanation. And it's almost 10. Okay. We want to thank also our audience here. We actually have around 35 audience who stay until now, from the beginning until now. So very long, and they are very interested. I don't see the number drops, meaning your presentation is very engaging them. All right. So now we would like to go to the Q&A sessions. Here, I will pose the questions and then at the same time to read out. For those who want to participate in our Q&A, please write your answers. Okay, get ready. Okay, first, why pathologies involving hearing organ might affect the balance organs? Any answers?
Why pathologies?
Yeah. However, this is an open questions. So the questions, the answers will be decided by Dr. Haniza, who is actually answering correctly. Okay. Anis, let me control. We are not asking this way. All right. Okay. So I haven't seen any response yet.
What pathology or why pathology?
Yeah, the question is what or why, doctor?
Why pathologies involving hearing organ might affect the balance? Yeah,
Yeah,
it's correct. The question that you're showing is correct. Why?
it's
Why
correct.
pathologies?
Okay. Anyone who would like to answer, feel free to type your answers in open questions. All right. So, doctor, no one answer.
It's actually because of the anatomical nearness of the structures. They're very near. And also they're sharing the same domain, same fluid physiologically. Yeah, and
I
the same nerve. Yeah. So that's why
Yeah,
when
it's-
it's affected, then the
Because
balance organ might be affected as
You
well.
see, the cochlea and the vestibular system are very close. So is the sensory into the brain.
Yeah.
One is in the brain. It's in the ischial slope and the PIVC. So they are very close in the temporal lobe. So both
yeah.
sides. they are
Yeah,
close.
so just to show you all, this is our cochlea. I happen to have one dummy here. So this is a cochlea. This is inner ear system, and this is actually the vestibular system. All right. So the three semicircular system. So we call it vestibular system and also the cochlea. Hence, the hearing organ, when they are affected, the balance system will be affected as well. Okay. All right. So Anis, let me control the questions that I already posted in the banner. Okay, the next questions is that, okay, this would be very easy. What might be the sign or symptoms that a child might have a dizziness? Okay, name three. What are the signs and symptoms that a child might have dizziness? So because just now, I think at the last part, Dr. Haniza had covered that dizziness may also happen for children, especially children with hearing loss. Some of them, they have some balance issue, but it's got undetected. Okay, so we have the answers. Okay, because from choosing, because when you have hearing loss, it will reduce the auditory input. So Dr. Haniza, is it correct?
Not quite right.
Not quite right. Okay, good try. Try again, Jising. Thanks. Okay, so let me pose the question again. The question would be, what might be the sign or symptoms that a child might have tinny and dizziness? Just now we are saying. All right. So while waiting, because there is a StreamYard have some delay while waiting, so we can chit-chat, continue chit-chat, Dr. Pravi. So anything that you want to tell anyone here about some important points. Okay, Qing has actually mentioned unsteady gaits fall frequently, feel that the environment is spinning.
Yeah, well done.
Well done, choosing. Okay, so we have our first winner for the 20 ringgit Touch and Go voucher. Please remember to leave your phone number. No need to leave in our comment box because you just text us, PM us, and then we will contact you shortly. All right. And okay, the next questions we have here is that what is the term used to describe aging in vestibular system? So we have a term for hearing loss. Aging hearing loss is called presbycusis. Then how about the aging in vestibular system? Anyone want to cry? I knew that there's a lot of audiologists on this live. Don't be shy to share your answers. All right. Okay. Usually, this is quite uncommon that I see the Facebook Live. The answer is not coming straight away because I always love to participate in the Q&A and win the prizes. Okay. All right. Okay. So we have the answers. Presby vertigo. Yes, you're right, Miss Fatiha. So I think
Congrats,
Miss Fatiha
Fatiha.
is also a student, right?
Fatiha was working with, she was my student and she was previously working with Subang.
Yeah, she was working with me. She's a very good,
Yeah.
hardworking student.
Okay. Well, very good supporter, Fatiha. Thank you. Okay. So we also have Afika and also Afika and so Dini who answered the rest. But we only depend on my StreamYard first answers. All right. So keep on. All right, Fatiha, remember to contact SoundLIFE, to get your prizes. All right. The next questions. Okay. Okay. When is vertigo due to PPVV, which is crystal in the inner ear, is treated with medications? True or false? Okay. So this answer is either true or false. So I think just now VPVV we have spent quite a time and watched some videos, interesting video sharing from Dr. Puraviappan. So let's see. Wow, Jusing, thank you. Okay, she is a very good listener and good supporter. Right. Okay, Jusing, well done. Yes, the answer is true. Okay.
Are you sure?
Sorry, the answer is not true. Okay, someone who control the best stage, please don't confuse me.
Answer is
Sorry,
wrong.
sorry. The answer is
Atika
false.
got the one.
Okay. Yeah, Atika, you got it right. Sorry. I'm so sorry. Okay. Well done.
It's late now.
Yeah, I think it's late now, and it's seldom I pass 1.5 hours for my life. I also feel, is it too late for now? All right, congratulations, Atika. All right, let's move to the next one. So we have given out 3 of our 20 ringgit Touch and Go voucher. The next one will be winning SoundLIFE diagnostic hearing test. All right, which is worth 110. Okay, we have 2 prizes for this. Okay, next. Is severe to profound hearing loss is more prevalent for vestibular problem? True or false? Okay. Sometimes true or false. All right. So let's see. Anyone answers? Sometimes when it's true or false only, I also not sure when you put the answer. Michelle. I have one Michelle answer true. Michelle answer true first. So congratulations, Michelle Ng. So feel free to congratulations. Remember to PM SoundLIFE and then claim your hearing test voucher. All right. So the next questions. The next and the last questions. Okay. Can balance disorder affect cognitive function and cause frequent fall in the elderly? Answer is true or false. Okay. Well, we have Klinik Pakar Kanak-Kanak Wong from Kajang to join us for our live tonight also. Thank you, Dr. Wong. Okay. All right. So we have choosing again. Congratulations, choosing. The answer is true. Yes, those who is having hearing loss, more severe one, they tends to also develop balance disorder. Okay. Thank you so much for Fatiha, Atika, and also Ella. Thanks for staying late for our live as well. And also Siti Aisha, Dini. So I think that's all for our tonight's sharing. All right. Any last word to our audience, Doctor?
Dr. Pravi, go first. Yeah.
Basically, what I want to say is vertigo is a common problem. So normally they have to see doctors, particularly those who are specialized in this area, either a neurologist or ENT, or also called a neuro-otologist. In Malaysia, we don't have a neuro-otologist, but any doctors who have special interest in vertigo. And the most important thing is to spend time with the patient, to take proper history. History. 90% of the answer is in the history. And then you do appropriate investigations, not MRI straight away, but more of because MRI only can pick up tumors in the brain for chronic ones. Unless acute, you can use stroke. So most of our patients, what they do is they straight away want to do MRI, which is not necessary. More important is to do specific balance testing. Then you can exactly identify where is the problem, and then you can get appropriate diagnosis. There are more than 40 different diagnoses in vertigo. So sometimes patients say, "Oh, that my doctor told me I have vertigo." Vertigo is not a diagnosis; it's just a symptom. So patients must ask the doctor, "What is the cause of my vertigo? What is my diagnosis?" Then you can they can get the appropriate treatment for it. That's my comment on this.
Okay, so meaning to say that if you see a doctors who don't take a long history with you, then you might consider to see another doctor who is more specialized in
vertigo. The answer is in the history. 90% of it is history again.
All right. Thank you, Dr. Puravi, for your advice. Okay, how about for you, Dr. Haniza?
Yep. I would like to advise my fellow audiologists who I think most of them, the name that you mentioned, are present tonight, and the ones that might view these videos later, to equip ourselves with a vestibular and balance knowledge. And because I think in our country, there are 3 universities who are producing audiologists: UKM, USM, and UIAM. And UKM was the first and the pioneer universities in Southeast Asia to produce audiology in this region. So the audiologists produced in our country are well equipped with the knowledge and well trained when it comes to vestibular and balance. So as Dr. Puravi mentioned, diagnosing vestibular and vertigo problems are not only relying on MRI. Previously, years back, yes, it's a gold standard to conduct MRI, but nowadays it's more towards evidence-based practice, whereby we are relying much on the objective measures that are conducted in the clinic, such as VAMS, VHEAT, VNGs, and all those are being trained by the audiologists in our countries. So as public who are viewing this, please seek help. Don't take things lightly. Seek help for the right person, for the right professionals. Coming from, I'm also the president for MANSA, for Malaysian Society of Audiology. We have our website, mansa.org, mansa.org. Do Google up, and we have a list, and we also have MASH, MASH, another societies where we have audiologists as well. They have a list also as well for practicing audiologists, and also of course ENTs who have the ability to diagnose vestibular and manage them. And for SoundLIFE, for Alleya, thank you for having me tonight, and thank you.
Thank you.
Thank you. Thank you, Dr. Puravi. Thank you, Dr. Haniza, for your time. For those, any one of you who like to find us for any questions. Oh, okay. Congratulations to our winners. All right. Tan Chu Sing, Fatiha, Atika, Michelle, and also Tan Chu Sing. Congratulations. And then for those who wish to find us for any consultation later, please contact us. And this is our details. Can you share the details, contact details? And it's okay, we will share it in our comment box later. All right. So thank you, Sasvina. No, Sasvina. All right. And then thank you, Fatiha, for your time as well. All right. Okay, that's all. We conclude for our tonight's talk. Goodbye.
Bye.
Bye.